It is my hope as country director, and it is our hope, that all of us, PR, SR, SPs, service provider, suppliers, and all the partners that will work together to successfully implement this grant. PR 2 will not succeed without PR 1, and the same is for
CCM, Global Fund, Ministry of Health, World Vision, and all other partners. We hope that as we go out of this 3 days workshop, we will work as a team, we will collaborate with each other, and we will continue to communicate effectively and efficiently for us to achieve our goals.
It's important that we have this startup workshop for so many reasons. One of the reasons why we wanted to have the startup workshop is that this is one grant, it's a country grant, and we needed everybody to be on board on this grant and also forge strong collaboration to be able to implement the grant. That is the general overview why we had the startup workshop. Nonetheless, at World Vision as well, we are also recruiting service providers and sub-recipients. Some of them are new to the process. Some of them have not been officially introduced to the government as well. So we wanted to have this startup workshop because we are optimistic that by having everybody in the same room, there will be interaction, there will be collaboration, we will forge strong partnership and relationship in terms of implementing the grant. And then lastly, for the World Vision staff that were recruited, not everybody has implemented Global Fund to the full. So we wanted to also have them on board and make sure that they understand the Global Fund processes. First of all, let me mention that the attendance is great. The selection of participants is excellent because most of the participants are decision makers from their own institutions, like the DMOs who make decisions in the districts. They are the representative of the district with respect to issues around health. And then heads of organizations who attended, like our service providers and also sub-recipients. And then at the ministry level also, the CMO, who is the highest medical person in the country, and also the technical lead for this grant was in attendance. And the directors also, the disease prevention and control director that oversees all the programs, including the program managers, they were all in attendance, and also heads of organizations in the KP space were also in attendance. So when you look at the cream of people who attended this program, you realize that it was an opportunity for us to meet and discuss issues around the grant. And having done that, we found out that we were able to have common understanding, asked questions, relevant questions that would help the grant to progress, and those questions were cleared. Nonetheless, not only asking and understanding ourselves, we are also able to have better clarity on the Global Fund regulations and also how we need to implement and going forward. I would say synergy was built. I would say understanding, we have it. I would say also part of the public health principles of collaboration and partnership, we're able to achieve them. And most importantly, we had government buy-in to say, hey, World Vision, you guys need to go forward with what you want to do.
On the 14th of June, when the president launched the grant, or before he launched, for those who were there, you had me make an undertaking. I made a commitment to His Excellency. I told him, with the marching order he gave us, because we have a very strong background there we are coming from. GC6 was not implemented initially very well until he had to step in as president. I promised him we will not give him cause to step in anymore on your behalf, on our behalf. And I promised him that we've learned our lessons and we can push together. And why did I make that promise? It's because of the way we started in 2023, worked together very strongly. And for the first time, by the time we left in February when Sibla and others left, we were already almost 80–85% with the grant taken. It has never happened.
On behalf of the Global Fund, I would like to extend that we all wish for successful discussion to help us implement activities in an impactful manner that can help us to say, yes, we did an excellent funding request, we did an effective grant making, which was launched by the President. Then come every semester, we demonstrate a result that can really be tangible and makes the Sierra Leone government, people of Sierra Leone, proud on the hard work that we all are doing collectively.
Our responsibility for me as a director is to provide a strategic direction. So whenever the programs have critical issues related to data, those are things that we are doing, and we continue to work that bilateral relationship across all the disease programs across RSSA.
Now, we designed this workshop with the help of the US team and West African team to be able to help us have seamless implementation. So this workshop has very tangible products that we can hold on to help us implement. Some of those tangible products are organizations working with us, that's the sub-recipients, service providers, third-party logistics. All of them have defined one-year work plans, so we can call on them at any time to ask on where they are regarding the work plans. That's one. And then secondly, in every project there is need to track implementation progress. And what we used to do this is called the performance framework. Every organization now understands their scope of work, and also they have aligned their scope of works with their performance framework. So we can say for sure we will track progress implementation and also report success. And then lastly, how do we want to work? That is the implementation design. We have had common understanding on how we want to implement this grant. So going forward, we don't have ambiguity on who is doing what. Role clarification is there, who is doing what, and who needs to move forward with certain activities. So for me, I see it as the beginning of progress, because we have the disease programs understanding when to call on us. And as an institution, World Vision, we have tried to also make certain things clear to our donor and also to the people we are funding in terms of this grant. So I see us making significant leap from this point going forward.